Dr. Terry Wahls is a clinical professor of medicine at the University of Iowa. She's also a patient, having suffered from multiple sclerosis for several years. Because of her medical background, she began to research alternative methods to combat this disease. Today, you would never know she ever suffered from such a debilitating condition because she has, for all intents and purposes, cured herself, primarily through simply changing her diet.
So MS is an autoimmune condition. So the body is attacking the brain and the spinal cord. In particular, it's attacking the myelin. People develop symptoms typically over years, sometimes decades. In my case, I was diagnosed in 2000, but in retrospect, I probably had symptoms beginning 20 years earlier when I was in medical school. At the time I was diagnosed, I had problems so that when I walked, the left foot was slapping the ground a little differently. I was developing a foot drop and began to have problems stumbling. I took Copaxone, a daily injection, in an effort to prevent and slow the disease progression. Still, within 3 years, I had enough problem that it was difficult to walk, it was difficult to sit up. My doctor suggested that I get a tilt recline wheelchair and that I begin chemotherapy, which I did do.
Okay.
So, you know, when I was first diagnosed, I started reading the medical literature to understand my disease. And that was back in 2000. At that time, it was very distressing because I saw within 10 years, half of everyone who's been diagnosed can no longer work because of fatigue, that a third of the people will have difficulty walking, needing a cane, a scooter, a tilt recline wheelchair. And it just got me more and more agitated. So my family convinced me that I needed to stop reading. And it wasn't until I hit the wheelchair that I went back to reading the medical literature. So in 2003, when I got my tilt recline wheelchair, I started going back, reading about the animal models for MS. And slowly I relearned cellular physiology, neurophysiology, immunology, and I concluded that mitochondria were a very, very important part of why people were developing problems with MS. And with more reading, I found some articles that mouse brains had been protected using some particular vitamins. And so I translated these mouse-sized doses into human-sized doses and began what I now call my first round of self-experimentation. And so I started with B vitamins, creatine, coenzyme Q. And what I discovered were that these very targeted vitamins and supplements, while they hadn't made me dramatically better, if the days that I didn't take them at all, I couldn't get out of bed. So my conclusion was that these vitamins were in fact helping slow down my rate of decline. Yeah, I was thrilled because I had been declining at a very steep rate, and with the addition of the vitamins, things were slowing down at a much more gradual rate. And you know, I kept reading my confidence. I was slowly developing a much longer list of nutrients, vitamins, supplements that I think were very helpful. In the summer of 2007, I discovered the Institute for Functional Medicine. And they had a lovely course, Neuroprotection, a functional medicine approach for common and uncommon neurologic syndromes. Took that, learned a lot more brain cell biology and things I could do to protect my brain. So now I had a much longer list of nutrients, which I began. But then I had, what I think was probably the most important epiphany was, instead of taking synthetic vitamins and supplements, I should be getting this long list of nutrients from the food that I ate. And so then I had another round of research trying to figure out where these nutrients were in the food supply. And ultimately I created then what I now call the Wahls protocol, which is this food plan designed specifically for my brain cells and my mitochondria. So the foods I was trying to maximize were the green leafy vegetables, sulfur-rich vegetables. That'd be vegetables in the cabbage family like broccoli, cauliflower, Brussels sprouts, radishes, the onion, garlic family, brightly colored, and then grass-fed meat, wild fish, organ meats, and seaweed.
How drastic was the change once you began living your life according to this diet?
In November, I was taking my long list of vitamins and supplements. I was also exercising, meditating, massage, doing neuromuscular electrical stimulation that was designed for my muscles. So I was doing a lot of things. Within 3 months, I was able to sit up in a regular chair again.
Okay.
At 5 months, I was able to walk throughout the hospital without a cane. At 7 months, I got on my bike for the first time in 5 years, pedaled around the block.
Wow.
And at 9 months, I went on an 18-mile bicycle tour with my family.
That's incredible. In the studies you've been doing so far, you have been finding positive results like you did with yourself so far?
Yes, we have.
Awesome.
Yes, we have. I've now have been giving grand rounds to neurology, psychiatry, family medicine, both at the College of Medicine and around the country and now internationally as well.
Okay.
I think physicians needed to see that this was going to be more than just me.
Yeah.
And when I was able to begin talking about our research, showing that we're having really quite remarkable results in others with progressive MS. And people are getting very excited.
It seems to me that our society today is possibly almost over-medicated in a large. Do you agree with that?
Oh, absolutely. So our diets are so poor that half of Americans do not have requirements for vitamin A, C, or the B vitamins. 2/3 don't meet our requirements for minerals, and 3/4 don't meet our requirements for the omega-3 fats. Probably 3/4 of us are severely vitamin D deficient. When you're missing those building blocks, you can't run the chemistry of life properly. So structures get made incorrectly, blood vessels become stiff, the heart muscle gets weak, the brain becomes befuddled, and we become progressively more and more unwell. And I was guilty of this as anyone else, physicians, we quickly make a diagnosis, we treat you with drugs, surgeries, devices. Instead of figuring out, are you eating what you need to be eating? Do you have the micronutrients to conduct the biology of life properly? That's the real solution that is needed and often never considered. More and more young physicians that are getting much more interested in nutrition and in health behaviors. At the College of Medicine where I'm teaching, we've gotten more and more of our curriculum focused on nutrition and on health behaviors. So I think it's possible. We absolutely need to get our young docs or young nurses fired up about health behaviors. So when they grow up and are active treating their patients, they'll use those behaviors. Our country, we're flying off the cliff in terms of our healthcare costs. The solution is very simple. It's vegetables, berries, grass-fed meat, seaweed. We don't need all these drugs. We need vitamins, minerals, we need food. And I use these concepts in my primary care clinics for people with heart disease, diabetes, obesity, rheumatoid arthritis. And again, their symptoms steadily improve, energy and vitality goes up. My conclusion is that by teaching people how to eat and live for health, over time, their bodies will replace these broken down, incorrectly made molecules with ones that are correctly made. Energy improves, vitality improves, mental clarity improves, the need for medication steadily declines. So if we're missing the micronutrients, that is the vitamins, minerals, essential fats, and we don't have enough calories, we become, we're starving, like the tiny kids from Biafra. If we're missing our micronutrients, that is the vitamins, minerals, essential fats, but we have too many calories, then we'll become obese and we develop chronic diseases, the high blood pressures, diabetes, heart disease, autoimmune problems. How to eliminate this? Get rid of the white flour, sugar, high fructose corn syrup, get rid of the potatoes, the nightshades, and eat greens, sulfur vegetables, bright colors, grass-fed meat, organ meat, and seaweed. What I see in my clinical practice is when people adopt the Wahls protocol, they're losing weight, they're not hungry, they have more energy, and they're like, oh my God, I had no idea how great I could feel.
That's something interesting that I've heard is that, with so many of the additives and everything in the majority of our food today, like you said, we're getting these calories, but we're essentially starving still.
Yes, absolutely.
Yeah.
We are starving. That's why we're chronically hungry. And because we're starving for the building blocks our cells need to do the biology of life,
Yeah.
Reactions don't happen, or they happen incorrectly. You have broken down molecules that are now making your blood vessels stiff, your heart muscles weak, your brain befuddled, that are tipping you to an autoimmune problem like MS or psoriasis. It all begins with broken biochemistry.
Yeah.
And the broken biochemistry begins with the wrong chemicals added to our food and the food being stripped of the vitamins, minerals, essential fats.
How do you think we can get the message out, or how do we teach people how to practice proper nutrition in the society that we live in today?
Well, I can simply tell you what I do.
Yeah.
So when I'm teaching the public, I freely acknowledge that in my clinical trial, our patients tell us it costs 30% more to eat the way we have them eat. And yes, it is more expensive. I tell people that you're going to pay, we can't escape the cost. We're going to pay now for food that restores our health, or you pay me in the doctor's office for surgeries, for missed time from work, early disability, early nursing home care.
Yeah.
But you're absolutely going to pay. I also spend more time now teaching and talking, both when I'm talking to the public and when I'm talking to my patients, to grow your own food. Use container gardens, go to communities gardening, have farmers markets. So I think it's important to take back your food supply. And for many people, I encourage growing your own food. That is a very powerful first step. We are destroying our future.
Yeah.
1 out of 3 children being born today, or 1 out of 2 for African American or Hispanic, will become obese and diabetic as young children or young adults.
Mm-hmm.
Their lives will be shorter than their parents' lives. Their healthcare costs will be enormous. The probability of early dementia and confusion, nursing home care, very, very great.
Yeah.
If you look at fertility rates, you'll see that the sperm counts around the globe have been falling steadily.
Mm-hmm.
And I believe right now 1 in 4 pregnancies require assisted reproductive technology.
Wow.
Because of infertility. We're destroying our future, and we're destroying our food supply.
What are your thoughts on GMOs and the effects that they're having on us?
When we insert these new genes to make a genetically modified organism, one of the things that Monsanto has done is it dramatically increases the amount of pesticides that are used. So we have 4 to 10 times the pesticide burden on the food supply when it's genetically modified. So that's number 1, much greater toxic load. Problem number 2 is that these genetically modified organisms are much more likely to cause a food allergy in the person who eats them. And then the third problem, in the few limited animal studies that have been done, those animals are far more likely to be infertile.
Okay. That's
By the 3rd generation, those animals that have eaten the genetically modified foods are sterile.
Wow, just in 3 generations.
3 generations.
You know, I've read, you know, that they've developed new ways that and essentially instead of having to spray the crops, you know, they genetically modify the corn so that the toxin is inside the corn.
Yes,
and
that's right.
we're ingesting that.
So we're eating that corn that can make the BCG. And what happens is those genes can then be picked up by our bacteria. So now I'm making some of these pesticide-like compounds in my own bowels.
Wow.
And all of these compounds will have biologic effects that my liver and kidneys will have to analyze, metabolize, and then excrete. And so it always puts a greater and greater strain on my own detoxification pathways to keep eliminating all of these toxins. As of 2010, I believe 95% of the soy grown in the US is genetically modified.
Wow.
And I believe 85% of the corn is genetically modified. The Monsanto's done a very good job of getting the FDA to approve having this food not labeled.
Promoters of Prop 37 say it's a simple little food labeling measure.
But a coalition of more than 500 doctors, scientists, and Nobel Prize winners say 37 is a complex, badly written labeling proposition that makes no sense.
Most people would prefer to have real food as opposed to this genetically modified food, but it's not labeled, so it's hard to tell. Unless you're buying organic, you have to assume that everything that you buy now is genetically modified. The good news is you and I will always decide what it is that we're going to eat. So we always have a chance to use our influence with what it is that we're going to choose to buy. So buying organic, growing more of your own food, and creating relationships with farmers that you know so you can support farmers who are local nearby. That's what's going to be required. I see some movements, for example, for urban chickens and creating urban farms. The more we can get that food supply closer to us, and frankly, the more we can get that into small entrepreneurs' hands, away from factory farms, the better for us all. I'm working on writing a new book that will go over in much more detail what I've done, why, because it's my mission. My goal is to help millions, if not billions of people learn that we can reclaim our health. Because if I can recover, when I was in a tilt recline wheelchair, couldn't sit up, was losing my keys, my phone, clearly getting befuddled. So I can get to the point where I can bike, go back to work, write grants, write books, and really thrive. And I see this happening over and over in my practice. We can all reclaim our health far more than we realize. That's my goal, is to get that information out there so that people can learn how they can restore the health and vitality of themselves and their family and the people that they love. The recovery is not going to come from the government creating and educating us how to eat for health. The recovery may come from grassroots, people learning from people like myself, from the books that other practitioners like myself will write, teaching the public how we can use food to restore our health and vitality. Yeah. It will absolutely be driven not by the government, but by the people themselves.
Are we as a society being over-medicated? According to a study by the University of Washington, more Americans will die this year from prescription drug overdoses than from any illegal substances. Perhaps it's time we take a closer look at the foods we eat and the effects they have on us, not only in terms of the diseases they can cause, but in those they can potentially heal as well.